Imagine this. You get into an accident in the United States. You survive, but when you open the hospital bill, the amount is so high that you start wondering, was it even worth surviving? Sounds crazy, right? But this is the reality for millions of Americans every single year. The US is the richest country in the world, yet it has the most expensive healthcare system on the planet. Americans spend over $4 trillion on healthcare every year. That's almost double compared to countries like the UK, Canada, or Germany. And still, millions of people remain uninsured. In fact, medical bankruptcy is so common in the US that people fear the hospital bill more than the actual illness. But why is healthcare so expensive in the US? Let's break it down. First, there is no strict price control. Pharmaceutical companies can charge whatever they want. Take insulin, for example. In Canada, a vial of insulin costs around $10. In the US, the exact same vial can cost over $300. And it's not only medicine. A simple MRI scan that costs about $100 in the UK can cost more than $1,000 in America. Even giving birth can leave families with bills of tens of thousands of dollars. The second reason is the insurance system. In most developed countries, the government plays a big role in regulating healthcare. But in America, people rely heavily on private insurance. And the system is extremely complicated. There are so many middlemen, insurance companies, pharmacy managers, billing departments. Everyone takes their share. And the patient? They don't even know the real price until the bill arrives. Another huge problem is administrative costs. Did you know that about 1/4 of all healthcare spending in the US doesn't even go to doctors, nurses, or medicine? It goes into paperwork, billing, and legal teams. Basically, hospitals spend billions just to handle the system itself, not to treat patients. And then there's politics. The healthcare industry is one of the biggest lobby groups in Washington. Insurance companies and pharmaceutical giants spend billions every year to influence lawmakers. So, whenever someone proposes big reforms like universal healthcare or government-negotiated drug prices, the lobbyists make sure those ideas don't pass. The results? Almost 27 million Americans have no health insurance at all. 2 out of 3 bankruptcies in the US are linked to medical bills. Even people with insurance face huge deductibles. That means, before the insurance even starts helping, the patient has to pay thousands of dollars from their own pocket. Now, compare this to other countries. In the UK, the NHS provides healthcare that is funded by taxes. So, treatment is free when you need it. In Germany, health insurance is mandatory but heavily regulated, so prices stay fair. In Canada, prescription drugs are cheaper because the government negotiates directly with pharmaceutical companies. And in all these countries, people spend far less money on healthcare but live longer, healthier lives compared to Americans. So here's the big question. The US spends more money per person on healthcare than any other country. Yet, life expectancy is lower and outcomes are often worse. How does that make sense? Clearly, money alone doesn't guarantee better care. It only guarantees bigger bills. What's the solution? Experts suggest reforms like allowing Medicare to negotiate drug prices, expanding public healthcare options, and cutting down administrative waste. But as long as powerful corporations control the system through lobbying, real change will be slow. So what do you think? Should the United States adopt a healthcare system like the UK's NHS? Or should it remain private and profit-driven? Share your thoughts in the comments. And if you found this explainer useful, don't forget to like, share, and subscribe for more deep dives into the issues that truly matter.